Question 1. In the context of cerebral circulation, Mr. Thompson, a 45-year-old male with a history of hypertension, has presented with symptoms of dizziness and headaches. His Doppler ultrasound exam shows a high resistance waveform in the middle cerebral artery at Mackay. Based on this information, which of the following is most likely to be observed in this patient? A. Reduced cerebral perfusion pressure due to increased intracranial pressure. B. Increased arterial velocity in the middle cerebral artery Mackay. C. Reduced velocity with normal diastolic flow in the Mackay. D. Normal pulsatility index in the posterior cerebral artery PCA. Answer. Correct answer. B. Increased arterial velocity in the middle cerebral artery Mackay. Explanation. A high resistance waveform typically suggests a vasoconstriction or decreased flow. In patients with hypertension, such as Mr. Thompson, the cerebral arteries may become more resistant due to chronic changes in the vascular wall, leading to a higher velocity in arteries like the Mackay. This could indicate impaired cerebral autoregulation, potential increased risk of ischemia. A high resistance waveform typically means that Mackay is not effectively dilating during diastole, often due to conditions such as vasospasm or narrowing, which can be common in patients with a history of hypertension. Option B is correct because this is commonly seen in vascular changes associated with hypertension. Options A, C, and D do not fit the expected findings based on the clinical scenario. Question 2. Based on the information provided, which of the following best describes the role of the circle of Willis in cerebral circulation? A. Ensures that the anterior and posterior circulations of the brain are well integrated, providing a collateral pathway for blood flow in case of occlusion. B. It only facilitates blood flow between the two hemispheres of the brain without providing collateral circulation. C. It maintains constant intracranial pressure regardless of systemic blood pressure fluctuations. D. It is primarily responsible for the drainage of venous blood from the brain. Answer. Correct answer A. It ensures that the anterior and posterior circulations of the brain are well integrated, providing a collateral pathway for blood flow in case of occlusion. Explanation. The circle of Willis is the critical structure that connects the anterior and posterior circulations of the brain. It is formed by the internal carotid arteries, the anterior cerebral arteries, and the posterior cerebral arteries, along with the communicating arteries. Primary function is to provide collateral circulation in case of occlusion in one of the major arteries, thus preventing ischemia. This compensatory mechanism ensures that blood flow to the brain is maintained even if one pathway is compromised. Option is the correct response because the circle of Willis is designed to maintain cerebral perfusion despite blockages. The other options misrepresent the role of the circle of Willis in cerebral circulation. Question 3. In response to a CE examination, the physician observes a significant reduction in diastolic flow within the middle cerebral artery Mackay after a 15-second breath hold. Based on this observation, which of the following is most likely indicated? A. Impaired cerebral autoregulation suggesting a potential ischemic event. B. Normal brain function with no significant cerebral circulation compromise. C. A marked increase in cerebral perfusion due to co-reactivity. D. Increased intracranial pressure affecting vascular flow. Answer. Correct answer A. Impaired cerebral autoregulation suggesting a potential ischemic event. Explanation. Cerebral autoregulation is the brain's ability to maintain a constant blood flow despite changes in systemic blood pressure. During the breath-holding test, carbon dioxide (CO) levels rise, which usually leads to vasodilation in the cerebral arteries to increase perfusion. If there is significant reduction in diastolic flow, it suggests autoregulatory mechanisms may be impaired, often due to ischemia or other vascular pathologies such as stenosis or vasospasm. This abnormal response indicates potential risk of ischemia, making option the correct answer. The other options describe normal or unrelated conditions that would not typically cause such response. Question 4. In the context of emboli detection using ECD, Assist Roberts, who has been diagnosed with atrial fibrillation, has presented with transient ischemic attacks, tears. What would be the most appropriate next step to confirm the presence of embolic signals, ease in her cerebral circulation? A. Perform A C. Examine to evaluate for high-intensity transient signals, hits. B. Conduct a carotid ultrasound to rule out extracranial disease. C. Use a contrast-enhanced TCD with agitated saline to detect microembolic signals. D. Measure the pulsatility index in the internal carotid artery (ICA) to assess vascular resistance. Answer. Correct answer. C. Use the contrast-enhanced TCD with agitated saline to detect microembolic signals. Explanation. In patients like Isis Roberts with atrial fibrillation and TIAs, there's a high risk of emboli traveling from the heart to the cerebral circulation, potentially causing transient ischemic events. The contrast-enhanced TCD with agitated saline is the most appropriate method for detecting microembolic signals, which are indicative of embolic activity within the cerebral circulation. These signals appear as brief, high-intensity transient signals, hits on the TCD spectrum, and are critical for diagnosing embolic causes of TIAs or stroke. While carotid ultrasound can help assess extracranial disease, it would not directly confirm emboli within the cerebral vessels. Option C is the most accurate step for confirming embolic signals. Question 5. Upon analyzing a CE of the posterior cerebral artery (PCA), Dr. Lee notices a low resistance waveform with a significant reduction in diastolic flow. What is the most likely cause of this finding? A. Normal finding due to the PCOS role in the posterior circulation. B. Vasospasm of the posterior circulation indicative of cerebral ischemia. C. High intracranial pressure causing a reduction in cerebral perfusion. D. Embolic occlusion in the PCA from a cardiac source. Answer. Correct answer. C. High intracranial pressure causing a reduction in cerebral perfusion. Explanation. A low resistance waveform with reduced diastolic flow in the PCA can indicate impaired cerebral perfusion, which is often associated with elevated intracranial pressure. High can reduce the driving pressure for blood flow, particularly in the posterior circulation, which is more sensitive to pressure changes. This leads to decrease in the normal diastolic flow component seen in healthy arteries. Vasospasm, while possible, would typically cause a higher resistance waveform, and embolic occlusion would typically present with a more abrupt cessation of flow rather than a slow reduction in diastolic flow. Question 6. During a C as if a patient with suspected brain death, Dr. Green observes a complete absence of cerebral blood flow. What should be the most appropriate action to confirm brain death in this patient? A. Perform a follow-up ECG exam after 24 hours to verify findings. B. Administer a contrast agent and perform a repeat ECG exam. C. Evaluate for flow in the vertebral arteries and posterior cerebral circulation. D. Document the absence of blood flow in major intracranial vessels as definitive for brain death. Answer. Correct answer. D. Document the absence of blood flow in major intracranial vessels as definitive for brain death. Explanation. In the context of brain death evaluation, the absence of blood flow in major intracranial vessels as observed on a C exam is considered a definitive indicator of brain death. The standard for brain death determination involves confirming the cessation of all cerebral circulation as evidenced by the complete lack of in both the anterior and posterior cerebral circulation. Options B are incorrect because they involve unnecessary follow-up testing that would not alter the brain death determination once the absence of flow is documented. Option C, while valuable in certain cases, is unnecessary when there is already complete absence of flow in the major vessels. Question 7. When assessing a patient's MSCI during a CESM, Dr. Patel notes that the mean flow velocity, MFE, has increased over several consecutive exams. This increase is likely to be most indicative of which of the following? A. Increased causing a compensatory increase in cerebral perfusion. B. Cerebral vasospasm, particularly following a subarachnoid hemorrhage (SAR). C. Normal variations in cerebrovascular flow due to changes in systemic blood pressure. D. Chronic hypertension leading to vascular remodeling in the MSCI. Answer. Correct answer. B. Cerebral vasospasm, particularly following a subarachnoid hemorrhage (SAR). Explanation. An increase in mean flow velocity (MFE) in the MSCI, particularly over multiple consecutive exams, is a strong indicator of cerebral vasospasm. Vasospasm commonly occurs after a subarachnoid hemorrhage and is characterized by constriction of the cerebral arteries, leading to increased flow velocities as the body attempts to compensate for reduced perfusion. This is a critical finding that necessitates immediate clinical intervention to prevent ischemic damage. Option is incorrect, as IP increases typically lead to reduced flow, not an increase. Option D, while potentially true in chronic hypertension, does not fit the acute nature of the finding here. Question 8. In the context of TCD monitoring for embolic signals, a patient undergoes a procedure involving the insertion of a central venous catheter. During the procedure, a series of high-intensity transient signals, hits, are detected. What is the most appropriate next step in the management of this patient? A. Ignore the hits as they are a normal part of the procedure. B. Increase anticoagulation therapy to prevent stroke. C. Discontinue the procedure and assess the patient for potential embolic events. D. Perform an MRI to assess for any ischemic damage. Answer. Correct answer. C. Discontinue the procedure and assess the patient for potential embolic events. Explanation. The detection of high-intensity transient signals, hits, during a procedure such as central venous catheter insertion suggests the presence of emboli within the cerebral circulation. Hits are indicative of microembolic events that may increase the risk of stroke or transient ischemic attack. Immediate discontinuation of the procedure and assessment are necessary to evaluate whether these signals are associated with a significant embolic event that could harm the patient. Option B, while relevant in certain circumstances, is premature without further assessment. Option D is not the first step, as immediate action during the procedure is critical. Question 9. Given the circumstances, which of the following is the most accurate description of the use of the Lindegaard ratio in TCD exams? A. The Lindegaard ratio is used to determine the level of stenosis based on mean flow velocity differences. B. The Lindegaard ratio is a method for assessing the severity of vasospasm, particularly following subarachnoid hemorrhage. C. The Lindegaard ratio is used to evaluate the cerebral perfusion pressure, and D. The Lindegaard ratio is only applicable to the internal carotid artery (ICA) and should not be used for. Answer. Correct answer. B. The Lindegaard ratio is a method for assessing the severity of vasospasm, particularly following subarachnoid hemorrhage. Explanation. The Lindegaard ratio is a calculation used to assess the severity of cerebral vasospasm, especially following subarachnoid hemorrhage. So it compares the velocities between the middle cerebral artery, McKay, and the extracranial internal carotid artery, ICA. A higher ratio suggests more vasospasm, which can guide treatment decisions. The Lindegaard ratio is not used to evaluate stenosis directly, nor is it focused on or cerebral perfusion pressure. Option B is correct, as it highlights the main use of the Lindegaard ratio in evaluating vasospasm. Question 10. In the context of cerebral autoregulation, which of the following is a key factor that influences the ability of the brain to maintain stable blood flow despite changes in blood pressure? A. Cerebral venous pressure. B. The elasticity of the arterial walls. C. The circle of Willis variations. D. The pH levels of the blood. Answer. Correct answer. B. Explanation. Cerebral autoregulation is a mechanism that maintains stable cerebral blood flow despite fluctuations in systemic blood pressure. The elasticity of the arterial walls is critical because it allows for the dilation and constriction of vessels in response to changes in pressure, ensuring adequate perfusion of the brain. Changes in blood pressure can trigger this response, maintaining cerebral flow in a range of pressures. Cerebral venous pressure does not directly affect cerebral autoregulation, as autoregulation primarily focuses on arterial blood flow. Circle of Willis variations, C, can influence cerebral blood flow but do not play a direct role in autoregulation mechanisms. Blood pH levels, D, influence vasodilation but are secondary to the autoregulatory mechanisms that control flow. Question 11. Based on recent studies, which of the following represents a primary challenge when assessing for cerebral vasospasm post-subarachnoid hemorrhage? So, using transcranial Doppler TCD. A. Inconsistent Doppler angles of insonation. B. Limited access to the submandibular window. C. Difficulty in distinguishing between vasospasm and turbulence. D. Inaccurate measurement of the mean flow velocity. Answer. Correct answer C. Explanation. Distinguishing between vasospasm and turbulence is one of the biggest challenges in TCD evaluation post-SAR. Turbulence, often seen in areas of high flow, can mimic the appearance of a vasospasm waveform. The correct diagnosis of vasospasm requires careful interpretation of the waveform characteristics, including an assessment of the velocity changes and their patterns. Inconsistent Doppler angles can lead inaccuracies, but the real challenge is differentiating the waveform characteristics. Submandibular window access B is not generally a significant barrier in assessing vasospasm. Inaccurate velocity measurements D are a concern in NTCD study but are not a primary challenge in identifying vasospasm post-SIR. Question 12. During the process of evaluating a patient's risk for stroke using TCD, which of the following findings would suggest a high likelihood of embolic events? A. Elevated pulsatility index pi in the middle cerebral artery MCI. B. Presence of high-intensity transient signals hits. C. Decreased mean flow velocity in the anterior cerebral artery ACAT. D. Increased flow velocity in the vertebral arteries. Answer. Correct answer B. Explanation. High-intensity transient signals hits are considered strong indicators of embolic activity. These signals are brief, high-amplitude signals that may originate from emboli passing through the cerebral circulation. Their presence suggests an increased risk of ischemic events such as stroke. Elevated pulsatility index pi can indicate increased resistance in the cerebral vasculature, but is not directly related to embolic events. Decreased mean flow velocity in the ACAT C suggests reduced perfusion, but not necessarily embolism. Increased flow velocity in the vertebral arteries D could indicate stenosis, but does not directly point to embolic events. Question 13. To better understand the principles of cerebral autoregulation, which test is often used to assess changes in cerebral blood flow when considering co-reactivity? A. Breath holding test. B. Transorbital Doppler. C. TCD examination. D. Suboccipital window insonation. Answer. Correct answer A. Explanation. The breath holding test is commonly used to assess cerebral autoregulation through co-reactivity. By instructing the patient to hold their breath, the levels of co increase, causing vasodilation in the cerebral vessels and measurable change in cerebral blood flow velocity. This helps evaluate how well the brain can adjust its blood flow to meet metabolic needs despite change in co levels. Transorbital Doppler B. Useful for assessing the ophthalmic and carotid arteries, but not for co-reactivity testing. ECD examination C. May be used for ongoing monitoring, but does not directly assess autoregulatory capacity. Suboccipital window insonation D. Focuses on the vertebrobasilar system, but not on co-reactivity. Question 14. In light of recent developments, how might one explain the correlation between elevated intracranial pressure IPE and certain TCD findings? A. Increased IPE leads to increased pulsatility index pi. B. Elevated IPE results in a decrease in mean flow velocity. C. Increased IPE leads to increased velocity in the anterior cerebral artery. D. Elevated IPE results in the reversal of flow in the middle cerebral artery. Answer. Correct answer A. Explanation. Increased intracranial pressure often results in a higher pulsatility index pi. This occurs because elevated IPE causes a reduction in the compliance of the cerebral vasculature, leading to increased resistance. The higher resistance to blood flow results in a more variable pulsatile flow pattern. Decreased mean flow velocity B is typically seen with vasoconstriction or reduced perfusion, not direct. Elevated IPE increased velocity in the ACAT C is not typical for elevated IPE. This could indicate stenosis or other conditions. Reversal of flow in the MCI D is an extreme sign of brain death, not a typical finding of IPE elevation. Question 15. When examining a patient with suspected brain death using ECD, which of the following findings would be most consistent with cerebral circulatory arrest? A. Absent diastolic flow in the internal carotid artery ICA. B. Rapid systolic spikes in the vertebral arteries. C. Normal flow velocities with turbulent flow in the MCI. D. Reversal of flow in the anterior cerebral artery ICA. Answer. Correct answer A. Explanation. Absent diastolic flow in the internal carotid artery ICA is a classic finding of cerebral circulatory arrest, which is a crucial diagnostic feature in brain death determination. In brain death, the brain's circulatory function ceases, leading to lack of flow during diastole. Rapid systolic spikes in the vertebral arteries might indicate hyperemia, but not brain death. Normal flow velocities. Turbulence in the MRI are inconsistent with brain death. Reversal of flow in the account can be sign of severe ischemia or brain death, but is less specific than absent diastolic flow in the ICA. Question 16. Considering the clinical implications of embolic signals, how should a technologist respond when high-intensity transient signals hits are detected during a EE monitoring session? A. Immediately halt the procedure and inform the physician. B. Continue monitoring and assess for any pattern of embolism. C. Document the presence of hits and proceed with additional imaging. D. Discontinue monitoring and consult with the hospital ethics board. Answer. Correct answer. B. Explanation. When high-intensity transient signals hits are detected, the technologist should continue monitoring the patient while assessing the pattern of embolic signals. These signals are often transient and may indicate the presence of embolic activity. However, they require ongoing observation to determine their clinical significance. Halt the procedure immediately is premature unless the patient is in immediate distress or at risk. A significant event. Documenting and proceeding with imaging is useful, but should be done while continuing real-time monitoring. Consulting the ethics board is not appropriate in this context unless there are specific ethical concerns, which is unlikely with isolated hits detection. Question 17. Under the assumption that a patient is undergoing a CE examination for stroke evaluation, which of the following findings would most likely indicate a significant stenosis of the middle cerebral artery and MRI? A. Increased flow velocities with a low pulsatility index pi. B. Decreased mean flow velocity with turbulence on the Doppler waveform. C. Elevated flow velocity with a high pulsatility index pi. D. Absent diastolic flow with high intensity transient signals hits. Answer. Correct answer. C. Explanation. A significant stenosis of the middle cerebral artery and MRI would typically present as elevated flow velocities due to the narrowing of the vessel and increased resistance, which causes a high pulsatility index pi. The increase in flow velocity is compensatory in response to the narrowing, while the high pi reflects increased arterial resistance. Decreased mean flow velocity with turbulence B suggests low flow, possible occlusion but not a typical sign of MKA stenosis. Absent diastolic flow with hits D points to severe ischemia or possible circulatory arrest, not stenosis. Question 18. The most significant aspect of TCD's role in stroke prevention is its ability to A. Detect vasospasm after subarachnoid hemorrhage, B. Identify high-velocity flow in the posterior cerebral artery PCA, C. Measure cerebral perfusion pressure in real time, D. Quantify embolic signals during monitoring for transient ischemic attacks TIAs. Answer. Correct answer. D. Explanation. The primary benefit of TCD in stroke prevention is its ability to quantify embolic signals during monitoring, especially for patients at risk of transient ischemic attacks TIAs. These signals are indicators of embolic activity, which can lead to stroke. By detecting these signals early, clinicians can take preventative measures. Vasospasm detection is crucial post-sub but is not specifically tied to stroke prevention. High-velocity flow in the PCA B is significant but not directly tied to stroke prevention strategies. Cerebral perfusion pressure measurement C requires additional equipment and is not typically done through TC. Question 19. Based on recent research, which technique is most commonly used to detect intracardiac and intrapulmonary shunts during ECD monitoring? A. Doppler ultrasound with color flow imaging. B. Contrast-enhanced TCD with agitated saline. C. Pulsed wave Doppler in the vertebral artery. D. Continuous wave Doppler in the middle cerebral artery. Answer. Correct answer. B. Explanation. Contrast-enhanced TCD with agitated saline is the most effective method for detecting intracardiac and intrapulmonary shunts. The technique involves injecting saline with microbubbles into the patient's veins, which are then monitored for their passage through the heart and pulmonary circulation, revealing the presence of shunt if the bubbles are detected in the cerebral circulation. Color flow imaging is not common. Used with TCD for shunt detection. Pulsed wave Doppler in the vertebral artery C does not assess for shunts but is used for measuring flow velocities. Continuous wave Doppler D is effective for stenosis assessment but not for shunt detection. Question 20. What would happen if an E-operator mistakenly insonated the M-skier at an angle that is too steep for optimal velocity measurement? A. The flow velocities would appear artificially low, possibly missing critical stenosis. B. The velocities would be exaggerated, leading to a false positive for stenosis. C. The Doppler signal would be absent, indicating a non-functional artery. D. The signal would be noisy, making interpretation difficult. Answer. Correct answer. A. Explanation. If the emici is insonated at an angle that is too steep, greater than 45 deg, it results in underestimation of the velocity. This error could lead to an inaccurate representation of the true blood flow, potentially missing critical stenosis or occlusion. Accurate angle alignment is critical for precise velocity measurements in TCD. Exaggerated velocities, B, occur with incorrect angles, but are more likely in the opposite direction, too shallow, absent signals. C could indicate problem with the artery, but not typically caused by angle errors. Noisy signals, D, are more likely to occur if the insonation depth or gain is improperly adjusted rather than angle related. Question 21. In evaluating the carotid artery using TCD, which of the following findings would most likely suggest the presence of a significant stenosis in the internal carotid artery ika? A. Increased systolic flow velocity with decreased pulsatility index pi. B. Decreased diastolic flow with normal systolic flow velocities. C. Increased systolic flow velocity with a high pulsatility index pi. D. Reversal of diastolic flow with absent systolic flow. Answer. Correct answer. C. Explanation. A significant stenosis in the internal carotid artery typically results in elevated systolic flow velocities due to the narrowing of the vessel along with a high pulsatility index pi. This reflects increased resistance to flow, which is a key marker for stenosis. Decreased diastolic flow, B, can occur with low flow states but is not specifically indicative of stenosis. Reversal of flow, D, is extreme finding and typically indicates severe occlusion or circulatory failure. Question 22. Which of the following is the most likely cause of a high-intensity transient signal hits observed during a E examination? A. Increased turbulence due to high flow velocities. B. Passage of microemboli through the cerebral circulation. C. Artifacts from the equipment or improper insonation angle. D. Detection of arterial spasm or constriction. Answer. Correct answer. B. Explanation. High-intensity transient signals hits are typically caused by the passage of microemboli through the cerebral circulation. These emboli can be a significant risk factor for ischemic events, especially in patients with a history of transient ischemic attacks, tears, or stroke. Turbulence due to high flow velocities may cause abnormal Doppler signals, but hits are specifically linked to embolic events. Artifacts C can be mistaken for hits but typically show different characteristics. Arterial spasm D can affect flow velocities but is not responsible for generating hits. Question 23. Which of the following is the primary limitation when using TCD for monitoring cerebral blood flow in patients with severe hypothermia? A. Difficulty in obtaining consistent Doppler signals due to low flow velocities. B. Overestimation of blood flow velocities in all cerebral vessels. C. Inability to assess the vertebrobasilar system during hypothermic conditions. D. Reduced sensitivity to embolic signals due to slow blood flow. Answer. Correct answer. A. Explanation. Severe hypothermia can cause low blood flow velocities, making it difficult to obtain consistent Doppler signals from cerebral vessels. This can lead to challenges in accurately assessing cerebral circulation during this state. Overestimation of velocities B is unlikely in hypothermic conditions where flow is typically reduced. Inability to assess the vertebrobasilar system C is not a primary limitation in hypothermia. Reduced sensitivity to embolic signals D could occur but is not the main concern in hypothermic patients. Question 24. What is the primary purpose of the breath-holding test when evaluating cerebral autoregulation (ITCD)? A. To assess changes in flow velocity due to fluctuations in blood pressure. B. To measure the reactivity of the circle of Willis during blood flow changes. C. To evaluate the impact of hypercapnia on cerebral circulation. D. To quantify the resistance of the cerebral vessels to varying systemic pressures. Answer. Correct answer. C. Explanation. The breath-holding test is used to evaluate co-reactivity and its effect on cerebral circulation. During the test, the patient holds their breath, which increases CO levels in the blood, leading to vasodilation in the cerebral vessels and measurable change in flow velocity. This helps assess the brain's ability to regulate blood flow in response to CO levels. Changes in flow velocity due to blood pressure. A. The primary focus of the breath-holding test. Circle of Willis reactivity. B. Is assessed indirectly but is not the main purpose of the test. Vessel resistance. D. Is influenced by CO levels but is not the direct focus of this test. Question 25. Which of the following ECD findings would be most indicative of an intracranial stenosis or occlusion? A. Low velocity in both the anterior cerebral artery CAT and middle cerebral artery imacae. B. High systolic velocities and a reduced diastolic flow in the imacae. C. Increased pulsatility index pi and low flow in the posterior cerebral artery PCA. D. Low flow velocities in the vertebral arteries and absent flow in the basilar artery. Answer. Correct answer. B. Explanation. High systolic velocities and a reduced diastolic flow in the middle cerebral artery imacae are key indicators of intracranial stenosis. This is typically seen when there is significant narrowing of the artery, leading to increased resistance and altered flow patterns. Low velocity in both the CAT and imacae suggests global perfusion problems, but not necessarily stenosis. Increased pi in PCA C could be to other factors like vasospasm, but does not directly indicate stenosis or occlusion. Low flow in vertebral and absent basilar artery flow D may indicate a more severe occlusion, but not stenosis in the MCAR. Question 26. When assessing a patient with suspected brain death, which of the following ECD findings would most likely confirm the diagnosis? They increased velocity with absent diastolic flow in the middle cerebral artery imacae. B. Complete absence of flow in the internal carotid artery ICA. C. Presence of high-intensity transient signals, hits in the vertebral arteries. D. Continuous high-velocity flow in the basilar artery. Answer. Correct answer. B. Explanation. Complete absence of flow in the internal carotid artery ICA is a classic finding when diagnosing brain death using ECD. It suggests that cerebral circulation has ceased entirely, which is a crucial component of brain death determination. Absent diastolic flow in imacae suggests severe reduction in perfusion, but may not definitively indicate brain death. Presence of hits C indicates embolic activity, not brain death. High velocity flow in the basilar artery D may be observed in certain conditions, but is not characteristic of brain death. Question 27. Which of the following is the best technique for monitoring the effects of vasospasm in patients following subarachnoid hemorrhage? A. Continue ECD monitoring to assess blood flow velocity trends. B. Serial CT angiograms to evaluate arterial narrowing. C. Contrast-enhanced ultrasound to visualize vessel diameter changes. D. Magnetic resonance imaging MRI of the brain for vessel imaging. Answer. Correct answer. A. Explanation. Continuous ECD monitoring is the most effective method for assessing vasospasm after a subarachnoid hemorrhage. TCD allows for real-time tracking of changes in blood flow velocity, which are critical for detecting and managing vasospasm in the early stages. CT angiograms B. Are useful for visualizing larger vessel changes, but are not the primary tool for ongoing vasospasm monitoring. Contrast-enhanced ultrasound C. Is not commonly used in this context for monitoring vasospasm MRI imaging. D. Is useful for detecting complications related to sub, but is not the best option for continuous monitoring. Question 20. In the context of TCD monitoring for stroke patients, what does a high pulsatility index pi typically indicate? A. Low cerebral blood flow or increased resistance in the cerebral vessels. B. Normal cerebral circulation with appropriate flow. C. Hyperperfusion and possible arterial rupture. D. Decreased risk of embolism and ischemic events. Answer. Correct answer, A. Explanation. A high pulsatility index pi typically indicates low cerebral blood flow or increased resistance in the cerebral vessels. This may suggest the presence of stenosis or other circulatory abnormalities that lead to impaired blood flow and potentially increase the risk of ischemia or stroke. Normal circulation, B, is characterized by a low pi, not a high one. Hyperperfusion, C, would be associated with a low, not high. Decreased risk of embolism, D, is not associated with a high pi. Question 29. Which of the following ECD findings is most consistent with a diagnosis of a transient ischemic attack tier A, high velocity flow in the middle cerebral artery or Mackay with increased pi? B. Presence of intermittent embolic signals, hits with normal flow velocities. C. Reduced flow in the posterior cerebral artery PCA with absent diastolic flow. D. Increased systolic and diastolic flow in both the ARDMS. Answer. Correct answer, B. Explanation. Intermittent embolic signals, hits with normal flow velocities, are often associated with transient ischemic attacks (TIAs). These embolic signals can temporarily occlude small cerebral vessels, causing ischemic symptoms that resolve quickly, making a valuable tool in detecting this condition. High velocity flow with increased pi could indicate stenosis or other vascular problems, but is not typical of TIAs. Reduced flow with absent diastolic flow C suggests severe ischemia or occlusion, not TIA. Increased systolic and diastolic flow D is usually seen with hyperperfusion, not a TIA. Question 30. In a patient with suspected carotid artery dissection, what TCD finding would be most suggestive of this condition? A. Elevated flow velocity with turbulent flow in the common carotid artery CEA. B. High velocity systolic spikes in the internal carotid artery ACA. C. Reversal of flow in the external carotid artery ACA. D. Reduced flow in the vertebral arteries with increased pi in the PC. Answer. Correct answer, A. Explanation. Elevated flow velocity with turbulent flow in the common carotid artery CEA is commonly seen in carotid artery dissection. The dissection causes a flap within the artery, which creates turbulence and an increase in flow velocity. Systolic spikes in ACA B are more likely seen with stenosis. Reversal of flow in ACA C could occur in severe cases of dissection but is less specific. Reduced flow vertebrals with increased pi in PCA D is associated with other types of vascular compromise, not dissection.